Vitamin D has been known to be associated with bone health, but many Americans don't realize vitamin D deficiency is also associated with heart disease, stroke, even a risk of dying. Here to tell us about vitamin D deficiency, its association with heart disease, and what you can do about it is 9 Health expert Dr. Pyle Coley.
What's very interesting is that observational studies where you look at people who have low vitamin D and you look and see what type of outcomes they have suggest that there's an increased risk of heart attacks, of strokes, of heart failure, and even of dying in those individuals that have low vitamin D. So vitamin D supplementation for a large proportion of Americans is probably recommended because the average American is likely to be vitamin D deficient. And what is recommended is usually about 1,000 to 2,000 international units or IUs per day. Now, for some people, that may not be enough if they're severely vitamin D deficient. Specifically, if your levels are below 30, then you may need to talk to your doctor about getting higher dose vitamin supplementation, almost like a loading dose, to get you up to speed, and then you could switch to that lower maintenance dose of 1,000 to 2,000 IUs daily. But what's very interesting is that studies published in the Journal of the American Medical Association have shown that even though lower vitamin D is associated with adverse cardiovascular outcomes and risk of dying, vitamin D supplementation in and of itself doesn't necessarily negate that risk. So the way I like to think about vitamin D is really like a marker of risk. So absolutely, it's important to replete your vitamin D if it's low, but realize that you may still be at high risk and you may still need to aggressively reduce your other risk factors. So the thing with vitamin D deficiency, it's not going to really present with symptoms. It's not going to tap you on the shoulder and tell you you're vitamin D deficient. So you really have to go looking for it. And the best way to know if you're vitamin D deficient is to get a blood test that measures your vitamin D. It's called a 25-hydroxy vitamin D level. And that's a really good way to know exactly what your state of health is.
Yeah, that reminds me, I need to take my pill. You can get a vitamin D screening through 9 Health at Quest Diagnostics Patient Service Centers. Visit 9healthfair.org to learn more, and you can sign up there too.